Hi, my name is Gabe, and I'm an athletic training student at Seton Hall University. Today we're going to be discussing hip abduction exercises. The first exercise is in hip abduction isometric, okay? And for this exercise, we're gonna actually use a belt, whether it's a gait belt or something that has some firmness to it. We're gonna size it for the patient in hand, and we're gonna make it pretty tight. Come on over here, get a little closer. We're gonna put this right above the knee joint line, right on the thighs here. And what the patient is going to do is, using her left side as the active side, is she's just gonna be pushing into that belt, creating a little bit of tension for a 3-second hold. In order to increase difficulty, we'll advance it to 5-second holds, 10-second holds, and even 15-second holds. And for this exercise, we're gonna do 10 to 15 repetitions for 2 to 3 sets. Our next exercise is an isotonic open chain hip abduction strengthening. Okay, the patient is going to be laying on their side in a comfortable position. Legs are going to be completely stacked. The weight that we have today is on her proximal thigh, and she is going to raise up to about a 45 to 60 degree angle. Good, nice and slow, nice and controlled. Okay. The bottom leg in this exercise can actually be belt for a little bit more stability if the patient feels like they need that. To advance this exercise, we can put the weight down closer to the ankle, increasing the lever arm, or increase the actual amount of weight. And in order to decrease compensations, we want to make sure that their leg is in line with their torso and that they're not rotating, externally rotating their hip open. Okay, so we'll go through a few repetitions like that. Good. And we're gonna go about 10 to 15 repetitions, 2 to 3 sets until that muscle is nice and fatigued. Our next exercise is an isotonic closed chain hip abduction exercise. Jen is going to get into an athletic posture. Okay, her involved leg is going to be on a towel to allow for a little bit of sliding. And what she's going to do is she's going to slowly and with control, slide that leg out. Nice and easy, just like that. She's not going to be bouncing too much. She's going to be in a nice stable position. And something like this we can do for repetitions, or we can do for time. In this case, we're going to do it for about maybe a 30 second, maybe as many reps as possible in that duration. We're now going to do a functional exercise involving hip abduction. Jen is going to get into a nice athletic posture, okay, about hip width apart, and she's going to shuffle to her right, and she's going to be driving off that left foot without bouncing too much. There we go. And this is an exercise that we can do. We can pick a set amount of distance, whether it's 10 feet, 15 feet, 20 feet, okay, and allow for about a 5 or 10 repetition performance until the patient is fatigued.